Need to move on. Ms. Capps.
I find it interesting too, but I really want to commend you all for the last panel of the day and think there's ought to be some kind of medal. Did we design medals for the last panel? We should have. This is our 4th day of hearings too, so if we seem a little kind of flat, you'll understand, I hope. But this is one I wanted to stay for particularly because you're so key, you and what you represent to us getting this right, and that is the goal, and that is exactly where we all are. And Ms. Ignani, I appreciate your taking us down, saying we've got so much we can't agree on, and let's at least agree. We don't agree. I don't agree with you on many things, and you know that, but that's okay. We can talk. I want to tell you, Ms. Collins, you hold the bar very high, and we're going to try to get as close as we can to the standards you're giving us. And believe me, I have constituents who are reminding me of that every single day when I go home, which is a good thing. This is all across the map. But everybody's attention is now focused on health care, and I salute that. It's about time. Mr. Khan, I'm a suburb. I have suburban counties north of your region, but I'm a big fan, as you know, because now I can boast that each of the 3 counties, I represent part of the 3, now has a county-operated program, and that yesterday we were able to get Mr. Freeman, who speaks very highly of you, to testify as a provider. It's now called CenCal. It used to be Cen, and they were one of the first to get a waiver, and there are some really exciting options that can be brought to the table now. Call them what you want, but they're going to help us deliver care. I have a tough, I want to share what it's like to be a member of Congress and have the phone ring and hear a story, and you know this. But I just want to bring it out and make sure that it's on the record. This panel gives me the chance to relay the story of a constituent whose situation really illustrates why we need to bring honest competition into the insurance market. I represent a little town called Carpinteria, a rural part of Santa Barbara County. A young woman is a good member of part of a nonprofit community organization. She has a 12-year-old daughter who was born with spina bifida and needs surgery to replace a stent in her brain. Her mother's income places her mother just over the threshold to qualify. She's not able to qualify for Medicaid. We call it the Healthy Families, the S-CHIP expansion in California. Though her mother's employer does provide coverage, the young girl is covered under the plan, but this plan specifically states that it will not cover the surgery she needs for her life because spina bifida is a pre-existing condition. Ms. Ignani, I'm going to start with you. I'd like to have comment for as much time as I have, and I don't want to go over time. But this plan that this mother has in rural parts of my district, there's one option in much of it, one private plan, and there are at most in Santa Barbara County, I think 2, maybe 3 at the moment. So she can't shop around very much. She called my office because she's beside herself. This denial is for a condition that this young woman was born with, and this surgery is needed to relieve the pressure of fluid on her brain. People have been talking about pre-existing conditions in the private sector for a very long time. This is real time. This is happening today in my constituency.
And Ms. Capps, I think there is no legitimate answer to your question, but to say this is why we have worked so hard to propose change, and the comprehensive proposal
it hasn't happened yet.
It has not happened yet because we have a system now where people purchase insurance if they're doing it individually when they feel they need it.
Of her employment. But
if it's part of an employer, then guarantee issue is
small employment employer, a nonprofit organization with a very minimal amount that they can spend for employee-covered care. But let me see what some other comment is. Maybe Mr. Khan. What would if this young mom was working for this nonprofit, which abounds in Los Angeles as well? What option might she have?
Well, Congresswoman. And by the way, you have a beautiful area that you cover. Your district's beautiful. And you did have the first of all of the county organized health systems there. The problem is a structural one, which is that the way our regulations and our markets are set up right now, that an individual, or if they're in a very small group perhaps, because usually pre-existing conditions are not excluded from group coverage. It may be such a small group, however, that it is. That could be the
Less
issue.
than 10
So not
employees.
knowing the situation,
That's true.
that could be the case. And there's, under the current system, to be perfectly honest with you, there's no good answer for that situation, for the individual or in a small group like that. That's the problem with the system right now, and why I think we all agree we have to change the system. Now, depending on her income level, it's
Not
possible.
very high.
Not very high. They could actually become eligible for Medicaid if they spend down enough, depending on what her income level is.
Pretty big price to pay.
And it's a very big price to pay. But that's the problem, is that we have a broken system right now that needs to be fixed. And that's why we're all here, because of those kinds of situations, covered but not covered.
Do you see our reform legislation being a remedy?
Absolutely. I think that the solutions that are being addressed...
From both the private sector and this public option, of course.
Well, I think that what we're talking about is reform of the rules around coverage. And indeed, you would accomplish that. Because once everyone's covered, then the pre-existing conditions issue should really go away. The problem right now is that, and we don't do individual coverage, we serve only low-income people, of course. But the problem with the system right now is that where people are not covered, they decide once they get sick, they need coverage, and that's why there's underwriting. I'm not defending it. It's just there are no bad guys in this play. Unfortunately, it's bad structures. It's a bad system.
Right, which is why it calls for intervention from us. Would you I mean, I'm not looking for support for that, but I applaud. This is finally the moment that all the stars are aligned. I think we would all agree that we're going to, not everybody's going to be maybe pleased with the outcome, but we are going to make progress. And I'm just so hopeful that we can do it in a very bipartisan way.
And Ms. Capps, I would be happy if you think it appropriate to help with your office and see if we can look into the case and see if there's anything that can be done. I would be delighted, as a mother, I would be delighted to do that.
Thank you. Mr. Whitfield.